Hello and welcome to Becoming Your Healthiest Self. In prior videos, we looked at nourishment and movement and exercise. And today we're going to look at unwinding or de-stressing our body and sleeping better. And then next week, we're going to look at connection and love. So the one zebra says to his friend, it's supposed to relieve stress, as he's holding the crayon. We've been looking at health in the context of metabolic syndrome. And we know at the root of this metabolic syndrome is the standard American diet or the SAD American diet full of processed foods. This diet has an excess of sugars, salts, processed carbohydrates, oils, meats, especially processed meats and fats. What's happening is we get increased insulin levels in the bloodstream. Fat increases in our midsection, in and around our organs, our vital organs. We have an increase of blood pressure and blood lipids. The fats are getting backed up into our bloodstream. Finally, the blood sugar levels stay high in the bloodstream because the insulin can no longer get all the blood sugar out of the bloodstream. And we talked last week about the secret weapon of movement and exercise, that it, along with a better diet, can help reverse all of these effects of metabolic syndrome. Today, we're going to talk about managing stress and sleeping well. This too, we will see, can also reverse all of these factors related to metabolic syndrome. Question, is stress always bad for us? Like first year, right? We need to be able to get going when we need to get off to work on time, finish homework, for example, when we're kids. So some level of stress is important. Stress hormones. I'm going to talk mainly about cortisol. Stress hormones, they're involved in the fight or flight response, right? If the building's on fire, we need to run out of it, right? And grab our kids and run out of the building. So our blood pressure rises to help us do this, right? Blood's diverted from our vital organs and to our muscles, so we can run as fast as we can, right? Our blood sugar levels rise so that we have enough energy to get us through whatever the emergency situation is. But all these systems are put on hold. But if it's short term, no big deal. It's okay and it's appropriate, because we need to be able to handle an emergency situation. However, when the stress becomes chronic and these cortisol levels remain high, then we're going to have problems in the body. And this has to do with these excess cortisol being produced in our adrenal glands. Eventually, this is not going to be good for our health to have chronically high cortisol levels. And indeed, it's going to contribute to this metabolic syndrome. So this video is about 4 to 5 minutes long, and it's having to do with this primary stress hormone.
A lot of people worldwide are unaware that they have high levels of stress hormone, cortisol. Having high cortisol over a longer period of time can have lasting negative effects on your health. In today's video, we'll talk about the signs and symptoms of high cortisol. Cortisol, also known as the stress hormone, is produced in the adrenal gland. These are two small glands that sit on top of the kidneys. Cortisol plays a variety of roles in your body, including regulating inflammation, controlling your sleep-wake cycle, regulating your blood sugar, blood pressure, and fight and flight response. And lastly, it regulates the way your body converts proteins, carbohydrates, and fats into usable energy. Your body continuously monitors your cortisol levels to maintain steady levels. Higher than normal or lower than normal cortisol level can be harmful to your health. Number one is weight gain around your abdomen or stomach. This is one of the most common signs of high cortisol. The muscles in your buttocks and your thighs starts to waste away, but your belly starts to get bigger. You often see this in older people, especially men over age of 50, where their legs become extremely thin, yet they get a buildup of hanging fat around the stomach. This is due to high cortisol breaking down the muscle proteins in the legs and turning it into sugar to give you energy. Then, insulin is converting the new sugar from your blood into the belly fat. You also get fatty deposits or buffalo hump on your upper neck. You also get a round puffy moon face. Number 2 is sleeping problems. If you wake up in the middle of the night with an overactive mind, this is a sign that you have too much cortisol. You might find it very hard to get back to sleep because your brain is overthinking, trying to make plans and solve problems when you should be resting. This is because cortisol controls your internal clock or circadian rhythm, and too much of it affects your sleep and keeps you alert. Also, not getting enough sleep can lead to fatigue or tiredness. Number 3 is high blood pressure. Stress causes high blood pressure by raising cortisol. If your body and brain thinks that you are in danger, it will release cortisol, which in turn will trigger release of adrenaline to increase blood flow and energy. This happens so that you can be able to run or fight when in danger. This is a normal response. However, if you suffer from long-term stress, this puts a lot of pressure on your blood vessels and keeps your blood pressure high and increases the risk of heart diseases and strokes. Number 4 is sexual dysfunction. Cortisol levels that are too high can cause sexual dysfunction. When cortisol is being overproduced, the sex hormones are not being produced in their usual quantities, which can lead to irregular periods, fertility issues, decreased libido, and erectile dysfunction. Number 5 has to do with your skin. High cortisol levels can cause wide red or purple stretch marks on your thighs, abdomen, chest, and arms. It can also cause easy bruising, excessive hair growth in women, and acne. Number 6 is neurological symptoms. High cortisol level can cause anxiety, confusion, concentration and memory loss, depression, suicidal thoughts, panic attacks, and irritability. Number 7 is effects on your immune system. Since cortisol works to decrease stress-induced inflammation, it also weakens the immune system, which can make you more susceptible to infections. When the body has high cortisol, the high level interferes with the production of anti-inflammatory substances called cytokines, and this causes decreased wound healing. Number 8 is bone and muscle weakness. High cortisol can cause osteoporosis and fractures because it reduces calcium absorption, bone, and collagen formation. Also, cortisol decreases amino acid uptake by muscles, which inhibits protein formation. This means you won't build muscles as well, which leads to muscle weakness in the upper arm and thighs. Cortisol also breaks down muscles and cause loss of protein in your thigh muscles and your buttocks. This can cause weakness and pain on your knees, especially when climbing stairs. Number 9 is high blood sugar. Under normal circumstances, cortisol counterbalances the effects of insulin to regulate blood sugars. Cortisol raises blood sugar by releasing stored glucose, while insulin lowers blood sugar. Having chronically high cortisol levels can lead to persistent high blood sugars, which can lead to excessive thirst, excessive hunger, and frequent urination. If you have some or all of these signs and symptoms, you may need a cortisol test.
So the medical condition when we have chronically high excess cortisol levels is called Cushing's syndrome. And this can be due to an abnormality in the adrenal glands. But again, these same factors occur with the high cortisol levels. And so you're aware that these commonly prescribed medications also use the anti-inflammatory effects of the hormone, but can also have these effects on our bodies. Stress hormones can trigger emotional eating. So this is no big surprise, right? I think we all know this, but it's been studied. And I just kind of want to read through this from one of the studies. And it says emotional eating is linked to consuming energy-dense and sweet foods and drinks. This was particularly notable for sweet and salt and fatty foods, such as cakes, biscuits, cookies, pastries, chocolate, ice cream, chocolate-based products, and confectionery, right, or candies. Another study in Finland reported that higher emotional eating was found to be associated with eating more sweet and non-sweet energy-dense meals, but not with eating vegetables, fruits, and berries. So this is an important point that, right, we're just not naturally inclined to eat these healthier foods. Good to be aware of. This consumption represents a way of handling negative emotions from psychological stress, and consequently, being in a stressful situation can act as a trigger to increasing consumption of these types of food. So how do we stop these impulsive behaviors? So we want to use an acronym. S is for stop. T is for taking a breath. Sense the chest rising and falling. And then O is for observe. Observe the thoughts or the story going through your mind and appreciate that thoughts are not facts. And then proceed. Move forward in a way that is consistent with your values. Poor sleep is also been linked to metabolic syndrome. Sleep disturbances, this study says, including obstructive sleep apnea, is highly prevalent in the United States. Additionally, obstructive sleep apnea is an independent risk factor for metabolic syndrome. One study reported that metabolic syndrome was over 9 times more likely to be reported in patients with obstructive sleep apnea. A few cross-sectional and prospective studies indicated that inadequate sleep duration is an independent risk factor for individual components of metabolic syndrome, including obesity, dyslipidemia, hypertension, and diabetes, all factors of metabolic syndrome. Poor sleep quality and insomnia symptoms are associated with poor metabolic health. So how do we get a good night's sleep and have better quality of sleep? Well, science tells us that if we have a pre-sleep routine with soft lighting, amber-colored lights, and avoiding screen time, 45 minutes to an hour before we go to bed, this can be really helpful. Having a regular bedtime and rise time, from the studies I looked at, regular bedtime and rise time was the most important factor. In exposure to morning light, we want our body to be aware of the circadian rhythm. When is daytime and then when is nighttime? When is it time to arise and when is it time to sleep? And then exercise and movement is really important, right? We want our bodies to be a little tired when we go to bed. And avoiding stimulants such as caffeinated drinks in the PM. No food and little to no liquids 3 or more hours before you go to bed. This is particularly important, especially with the junk foods in the evening that are disastrous for our metabolic health. Having a cool, dark, quiet environment to sleep. And so people find having a hot bath or a shower, gently stretching or doing some real gentle yoga, self-massage or meditation may be very helpful. And then having some background noise may also be helpful. A few quotations from the Baha'i writings regarding rest and relaxation. It says, however, you should not neglect your health, but consider it a means which enables you to serve. You should certainly safeguard your nerves and force yourself to take the time, and not only for prayer and meditation, but for real rest and relaxation. And then regarding sleep, regarding your question, there are very few people who can get along without 8 hours sleep. If you are not one of those, you should protect your health by sleeping enough, a minimum of 7 or 8 hours. A couple of questions to reflect upon. What is a healthy way for me to manage my stress? What is a healthy way for you to manage your stress? And then what will I do to improve my sleep quality and sleep duration? Thanks a lot. I hope you found this exploration of ways of reducing stress and ways of sleeping better helpful, and I'll see you next time.